Here is some Botox treatment. So let's go ahead and break it down for you here. What we are doing is we are treating the frontalis muscle and going to go ahead and soften and get rid of these forehead lines. This is a patient that comes and keeps up on the schedule, comes every 3 to 4 months for botulinum toxin treatment, and we are delivering this, as you can see, with a ComfortTox syringe, the best syringe to do this, sharpest tip, most comfortable by far, and she doesn't require a lot of Botox because she has had numerous sessions of Botox and she really keeps up on it every 3 to 4 months, and that means less and less dosaging for Botox as you go ahead and go through this, because the muscle has a muscle memory, and even when it comes back and the Botox wears off and the contraction comes back, it doesn't come back quite as strong. So that's the forehead muscle, and now we are going for the frown lines and the procerus muscle, the glabellar complex. The procerus is what pulls everything down. Now the corrugator muscles that push everything in, and that's what causes those 11s between the eyes and what we also call frown lines here. Look how Crystal here is holding the patient's muscles, really isolating it. Everything done is very strategic. We want to make sure that this Botox is only going into the muscle and the part of the muscle that she is holding and doesn't leak to any other muscles, because it will relax other muscles that we don't want it to go to if you don't go ahead and perform these very, very precision techniques, these AAFE protocols for giving botulinum toxins here. Now we're going to go to the crow's feet, as you can go ahead and see, and going ahead, always away from the eyes. It's amazing how many times you may see other trainers, other injectors go ahead and give Botox towards the eyes. That is the biggest mistake of the things that can go wrong, like double vision that really upsets patients. You've got to learn to be the best injector, and that's what the AAFE teaches, and that is why we put out the best injectors that are out there, because everything done is very, very precise as to how we hold everything, how much dosaging of the Botox goes into these areas, and exactly where we are going to put it. We are always, by the way, looking for the vasculature. We want to stay away from it to try to prevent or lessen any bruising here. That's really important. And every one of those dots that she is marked up with is, again, very precise as to the different parts of a muscle that we want to go ahead and treat. And those are some of the big tips and tricks that we do in the AAFE. And now we're going to go to that masseter muscle, that big jaw muscle on the side. And this can alleviate, first of all, it can slim the face, make the patient look great, but also alleviate any TMJ, bruxism, headaches, migraines, and those kinds of things. But look how it's well defined. Look how she's holding it. You've got to learn how to do this, and it's time for you to get AAFE certification trained on these great techniques here.